All right, I want to give you our coronavirus update here quickly. We have confirmed cases now, 127,000. That's up from 126,000 yesterday. Total confirmed deaths, 4,641. That's up about 300. Patients that have recovered, 68,000 plus. Now 125 countries have confirmed cases, up from 120 yesterday. This is the best news. The cases considered serious, requiring hospitalization, is down again today, down from 12% to 11%. We now have 1,336 confirmed cases here in the United States and 38 deaths. That number is about to go through the roof, and you will understand in the next 30 minutes exactly why and what to do about it. All 50 states have at least now one confirmed case or one presumptive case. President Trump banned travel from mainland Europe last night for 30 days. UK travel not currently affected. They seem to be doing pretty well with this. Ban will limit human travel. Cargo-only travel will not face any restrictions at this time. The order is effective as of today, March 12, 2020. President Trump indicated that he will consider other travel bans from any hotspots as a means to follow the CDC recommendations to prevent bringing more infected people into the U.S. Inbound travel to the U.S. is now restricted for over a third of the world's population, including China, the U.K., Korea, Japan, Hong Kong, and Iran. But we all know, thank God we have the press, we all know he's only doing this to Europe because they're different. They look so different in Germany and Sweden and France. Congress was told yesterday that COVID-19 is 10 times more lethal than the flu. If that comes as a shock to you, that you haven't been paying attention, that's right now 10 times more fatal than the flu. Containing the influx of infected people coming from other countries is super important, but also social distancing and isolation of the sick. Bottom line is, Congress was told this is going to get much worse quickly. The U.S. stock market is taking a beating. We've now into the bear market. We must be doing okay. We already closed once today. We took another breather on the stock market. It was open for maybe 10 minutes. Before they, can you stop coughing while I do this, dude? It's freaking me out, man.
Excuse me.
Can you just check on the stock market? I don't see it up in front of me, how we're doing. We took another 10-minute breather. I'm shocked that those things work, but this is something that was put into the stock market as a safety valve, just in case panic starts.
Currently down 1,900 points, 8%.
How much? 8%? We were down as much as 10% this morning. It stopped at 7, then it shot back up to 10. The next time they stop it, if it has to be stopped today, will be at 13% losses. They'll stop it for 10 minutes. Hopefully everybody gain their senses. And then it officially closes for the day if we ever hit 20%. So they stop it at 7%, then at 13%, then they stop it for the day at 20, hopefully. We won't get to that, but I will tell you, we are in for a very long haul. This is not something that is going to be over quickly. President Trump also taking a beating in his approval rating. Daily tracking poll, he stood at 1% net approval. That's approve minus disapprove on February 25th. Yesterday, it just came out, he is now 11 points underwater. That's a 12-point swing on the online phone-based survey. The president's handling of coronavirus cited as the major reason for the shift in voter attitudes. This is a ridiculous charge, in my opinion. Are there things that we could have done faster? Yes. Are there things we could have done differently? Yes. But he gets blamed for whatever he does. Yesterday, they were, I can't believe he's not doing enough. Okay, we're going to cancel all air travel for anybody who wants to come here for the next 30 days from, Europe, where it's just exploding. I can't believe he's doing that. Do you know what that's going to... he can't win. Joe Biden staffer accuses of Trump of deciding to let coronavirus get out of hand. This is a senior staffer, the digital director of the campaign, tweeted yesterday, sure seems like this is getting out of hand, and Donald Trump decided to let it be this way. The tweet comes as Trump asked all Americans to put politics aside, stop the partisanship, and unify as one nation and one family. The calls for the staffer to apologize gone unanswered. Nobody's answering that phone. Maybe because Joe Biden's expected to answer, and he's like, I keep hearing this ringing noise. I don't know what it is. The WHO finally calls COVID-19 a pandemic. We've known this for a while. They actually said yesterday, speculation I should say, those around suggested that the WHO did not call this a pandemic a couple of weeks earlier when we all knew what it was. It had fit the official definition. But the reason why they didn't say that it was a pandemic is because they were afraid that people would go, geez, well, if it's a pandemic, there's nothing we can do. The decision came out yesterday to finally call this a pandemic because they're hoping that they can get people from throwing up their arms and saying, see, this is really no big deal. It's a very, very big deal. New obstacles to testing in the U.S., lack of critical region chemicals. This is going to be a mounting problem. We need certain chemicals. We've been foolish. This really started under Clinton and then just spiraled under control. I've been talking about it now over 3 decades. This has been a topic of mine, saying we are foolish to give everything to China. They are taking control of our drugs, and if they ever turn into an enemy, they control what we can do. They control the medicine on the battlefield for America. Now the battlefield is America, and it's not bullets, it's the coronavirus. And we need our own services, and we need critical infrastructure here. But this has been a 30-year spiral out of control. It's going to take us a while. Between 70 million and 150 million Americans, they're now saying, are going to be infected with this. Fighting to make this 1% a reality, the case fatality rate of 1% is the goal. Let me say that again. Fighting to make a 1% death rate a reality is a goal. It's not automatic. The 1% case mortality rate for COVID-19 is not something that is consistent everywhere. 1% or less is achievable and possible, but it assumes infected people get critical medical care. And every single one of us now has a role to play, and we must take personal responsibility. Your role is very simple. Don't spread the disease. Don't get the disease. Don't expose yourself to large groups. And I'm going to give you some information here in just a second that will show you this is easier than you think, and in some ways harder than you think, only if you don't realize it's already here. It's already here. As we've seen in China, Iran, Italy, case fatality rates, 3.5% in China, 8% in Iran, 6% in Italy, are probable with COVID-19 once the hospital systems become overwhelmed. There's a goal that each of us should have. Do everything you can to not get infected. Wash your hands. Don't touch your face. Clean the surfaces that you touch all the time. Socially distance yourself from others. This will happen to you. I've been saying this for a while. We're all going to get this. And the reason why I've been saying it is because I want people to understand, this is never going to happen to me. It's not going to come here. It's not going to really be a problem. It's going to happen to you.